This is Dr. Sajid Maqbool talking about something a little different, and that is inappropriate use of medicines in general and antibiotics in particular. The story goes that this baby developed a little bit of a cold and a cough and seemed a little warm. The mother checked the temperature, it was 99. She used paracetamol, and till the evening she thought that the baby wasn't any better, was coughing perhaps a little bit more, and the temperature was about the same. So she decided on her own to start an antibiotic. The fever by the next morning was a little higher, 100.5, and the mother then started giving ibuprofen, which is also for fever. So by that evening, the baby had had 3 doses of antibiotics and 4 doses of ibuprofen, and the baby was about the same. So the mother decided to use a stronger antibiotic, which she'd experienced before through her doctor, and now the baby was taking a different antibiotic, and now she started the fever medicine every 2 hours. The next day the baby developed some loose stools, diarrhea, and so the mother decided to switch the antibiotic to another one which she thought would work for the diarrhea. The baby, however, stopped eating or started eating less, and the mother changed the antibiotic further. The loose stools persisted, and then the baby developed a little bit of a diaper rash, and the baby became a little cranky, so she used an ointment for the diaper area. The next day the baby's appetite decreased, and the baby continued to have low-grade fever and the cough and the loose stools. And now she noticed a few whitish rashes in the mouth, and the baby wasn't eating so well. So the mother came to see me at this time. Now this is what we call a perfectly normal scenario that happens in many mothers in our country. This baby was 1 year of age, so used an antibiotic, which is a good medicine for killing bacteria when it is a bacterial disease. But most of the conditions that we confront in children at this age, for example, cough and cold and a few loose stools, are viral, and therefore these medicines will not work. Although they are effective and we use them, in very special instances, we try to avoid them as much as possible. Now the reason for that is that when used properly, appropriately, like I said, they are very useful. But when we use them without giving any thought to the fact that these are strong medicines and special medicines, what happens is that they can have side effects. For example, a lot of mothers, even relatives, do not know that they can cause rashes, which can be very severe at times. Some reactions which cause rashes can be so severe that the baby can get sicker than what the baby started with. They also can cause loose stools or diarrhea. They can also cause allergies, and that means sometimes hives on the body or rashes. They can also cause fungal overgrowth or fungi in the mouth, for example, thrush or whitish lesions in the mouth. And if they've been used for a long time, they can also cause, surprisingly, they can cause fever, which we call a drug fever. Antibiotics also, interestingly, will cause vomiting and cause pain in the abdomen, and the baby can get very, very sick. Sometimes if you have used antibiotics for a long time, then the diarrhea can also contain blood, and this is again a serious condition. If antibiotics are given intravenously, they can cause damage to the veins through which they are being given, and they can also cause abscesses. So if you get the feeling that I'm trying to scare you about the use of antibiotics, you're right. When they are needed, they're very useful, but they must be given under the direction of a doctor who has assessed that your baby needs an antibiotic. When used without need or without supervision, they can be harmful, and there are many side effects that perhaps the parents may not be aware of. So awareness on your part will ensure that you don't give unnecessary medicines in general and antibiotics in particular.